Hello, my name is Randy Rogers. I'm with JABA, Jefferson Area Board for Aging. I'm glad to be here today to talk a little bit about Medicare. I will just say about JABA is, our mission is to promote, establish, and preserve sustainable communities for healthy aging that benefits both the individuals and families of all ages. And that's sort of important because most people don't realize everything that JABA does, all the various programs and stuff. In fact, when I started working there 10 years ago, I was like, oh yeah, I kind of know what JABA does and everything. And then I started working there and realized I had no idea of all the programs that were available. And so the nice thing is that we've done a couple of things. We have a brochure in the back that summarizes all of the different programs that we have. Also, that's on our webpage at jabacares.org. And there is a single line number that you can call. It's the helpline number, and that's sort of a good starting point to ask about what your needs may be for you or your loved ones. And then the people at that helpline are very good at finding things within JABA that could help you, or know about things that are outside of JABA that would help you. So that's a great resource. But we're here today talking about Medicare, and I run the Medicare Counseling Department. We call it Insurance Counseling. It's part of a bigger program, the federal level. It's called SHIP. It's State Health Insurance and Assistance Program. Somewhere they lost the A in the acronym. And at the state level, it's called VICAP, Virginia Insurance Counseling and Assistance Program. They did find the A and put it back in. And then when it comes down to the local level, at JABA, it's insurance counseling there. The program from the federal level on down is here to put boots on the ground to help people understand Medicare, have help with questions they may have for Medicare or problems they might be having with Medicare. So every area agency on aging around the country has a counterpart to myself. And so here we are very excited that we're able to provide that help for you. It's a free service. It's unbiased counseling. In fact, the Medicare counseling is done by predominantly volunteers. They are highly trained, and they are certified through the SHIP and VICAP programs to be able to provide Medicare counseling and advice. And because you're working with a volunteer, you know it's not somebody trying to make a dollar by convincing you should go one way or the other with your Medicare. In fact, one of my colleagues made this little tagline for us a few months ago. It said, "Get the facts, not the sales pitch." So when you talk with one of our counselors, you know that it isn't somebody who is trying to sell you something in the end. We help people when they first start with Medicare, setting it up at the beginning, that's very important, and then help with questions along the way that they may have with Medicare. And then every year we help people evaluate their options during Medicare open enrollment, which is actually starting next Wednesday on October 15th. So let me make an assumption that most of us are not necessarily on Medicare yet or heading towards Medicare that are here with us today. So let's talk a little bit about Medicare at a very basic level. First thing is, Medicare is unlike any health insurance program you have ever had in your past. When we try to start comparing health insurance you would get through your employer or something and how Medicare works, it's not just apples and oranges, it's like apples and giraffes. It is a completely different way that it is set up. There are two different paths you could go down for Medicare. One of them is Original Medicare, and the other one is Medicare Advantage. Now, under Original Medicare, you would have your Medicare Part A, which is your hospitalization insurance and other things like hospice and skilled nursing after a long hospital stay, are all under Part A. But the workhorse is Part B. That's the medical insurance, the doctors, the tests, the surgeries, the doctors in the hospital. All that's under Part B. So there's the workhorse. And then you would have a Medigap policy, and then a Part D for prescription policy as a separate policy. So they're all separate pieces under original Medicare. And then if you go with from original Medicare, you try to go with the Medicare Advantage, you're balling all of that up, and then you're handing your Medicare over to a private insurance company to manage. So we'll talk a little bit more about that as we move forward. But let's come back to just original Medicare, Medicare A and B. So if we think about it, when it comes to the medical bills, Part A and Part B will pay 80% of the medical bills. Then you're responsible for the 20%. And without a Medigap or anything, you're responsible for that 20% that has no out-of-pocket maximum. So there's no cap on the end of it. It's okay if you've got a $100 doctor bill and you owe $20, or maybe $1,000 for a test and it's $200, but you get into a long hospital stay or something, and now it's really big bucks that you are responsible for paying. So almost everybody gets a Medigap policy. It's also known as a Medicare supplement policy, interchangeable words for the same thing. So that will basically pick up the 20%. There's some nuance with that, but that's what we're looking at there. And then you would have a Part D prescription plan through a separate insurance company. Both the Medigap and the Part D are through private insurance companies, but they are very highly regulated in what they do and how they operate. So it's not quite the same as if you were working with a particular insurance company that was running all of your health care. If we're looking at the Medigap policies, and this chart is hard to read, it's not meant there for you to be able to read it all, but just to see that the federal government sets up letters for different types of plans and what they do. When I first started this 10 years ago, a lot of people were on F plans. Then it quickly shifted to a lot of people were going with G plans, and that's still the case today. A few people are going with N plans. So there's a lot of letters over here, but it really boils down to just a few of them are the ones that are viable. In fact, some of these letters, I've been doing this 10 years, seen tens of thousands of cards, and have never seen some of these letters come up. So like a G plan would be what normally would go on for most people retiring right now. And so it's covering that 20% of co-pays for Part B. Just a co-insurance if you go into the hospital, they wheel you upstairs to admit you in the hospital. That's a little over $1,600 in copay, but your Part G plan would pick that up. The only thing it doesn't handle is the Medicare Part B deductible for the year. So that's $257 right now this year. So that means if you were on A and B and you had a G plan, it could be Saturday night, your left arm has gone numb, you are, chest is hurting, and you're wondering whether to call the ambulance or not. Well, calling that ambulance, going down to the emergency room, them running a battery test on you, and then them deciding to wheel you upstairs for a couple of days till they figure out what you're going to do with you. Then they decide to have surgery. So you have the surgery, and then you rehab at the hospital a little bit, then you go over to Encompass for a week to get back on your feet. Then you go home, and you got physical therapy for the next 6 months or so. All of that, the cost for you under original Medicare with a G policy is $257. That's it. So as you say, this works really different than the insurance that you and I may be on through work, where you would have co-pays and co-insurances, a deductible you have to reach before it kicks in, and then maybe an out-of-pocket maximum. This is just straightforward it's covered under Medicare. Medicare pays their part. They send the rest on to your supplement policy. And the only thing you're responsible for is the Part B deductible of $257. I have a good friend I've worked with for years. She waited till she went on to Medicare and got her G policy, promptly went out and had her $50,000 knee replacement. It cost her $257. So vastly different than what you would have under insurance that you or I may know right now. So that's a quick summary of it. You would also pick up a Part D plan that would match your prescriptions in your pharmacies, and so it would be a different plan for a different company depending on what those are. Now, I am going to talk about Medicare Advantage, but I threw a slide in here that has to be said. The retirement program for the state, for retirees, the supplement, and the rest of the package is called, whoops, I went the wrong direction, called Advantage 65. Advantage 65 is not a Medicare Advantage plan. People get that confused all the time. Advantage 65 is actually a supplement plan, much like a G plan. And a Medicare Advantage plan is completely different. So, and I've been told the reason that it's called Advantage 65 is because the state had that name for that long before Medicare ever came up with the concept of a Medicare Advantage plans. And then the state was like, we had the name first, we're not changing it. So, just want to get that out. We're going to come back and talk about Advantage 65 at length, but I wanted to make sure we clear that up, that those are not the same things. So let's talk about Medicare Advantage plans. Medicare Advantage plans is when you take all of your Medicare and hand it over to a private insurance company. You still have to have Part A and Part B, but now under a Medicare Advantage plan, you have a provider network, you would have copays and co-insurances for various things, specialists, tests, blood work, surgeries, ambulance, all of that would have copays and co-insurances. And then most plans would have a maximum out-of-pocket ranging from anywhere from $3,000 or $4,000 to, I've seen they're running now with about $14,000 maximum out of pocket, so that gets pretty steep. These plans also, they can provide things that original Medicare doesn't have. Dental, excuse me, dental, vision, hearing aids, things like that. Now, this is where I got to step back and I say, Medicare Advantage plans across the country are of different calibers. Some places have great Medicare Advantage plans, and when you try to use them, they work really well. Then other places, like Virginia, don't have as good of Medicare Advantage plans, and when you try to use them, there's problems. So, you know, if you were moving to a different state, California, Florida, New York or so, you know, Medicare Advantage might be a great option for you for a Medicare Advantage plan. However, I also tell people don't listen to your cousin in North Carolina. They don't live here. It's different here than what it is there. And I'll point out the biggest problems are with Medicare Advantage plans in our area. Sometimes those extras they offer, dental, vision or stuff, you have a very difficult time finding anybody who will take those plans. So though you may have dental insurance, you may not be able to use it. They have networks of doctors and facilities and therapists and hospitals and so that are in their network and out of network or so, and so you have those, have to deal with that a little bit. But the biggest problem in our area has to do with whether or not the insurance company is going to approve your medical care. The denial rate for services in a place like California is under 1%. And the last I heard, the denial rate in Virginia under Medicare Advantage plans is over 9%. So, you got about a 10% chance that the insurance company is saying, I know your doctor's saying that they want to run this test, but no, we're not going to pay for it. Under original Medicare, that's not happening. Original Medicare, you're sitting there in the doctor's office, they say, hey, I think we should run this particular test or we should do this procedure. All you have to say, does Medicare cover it? They look it up in the book. Yep, Medicare covers it. Boom. You're not asking an insurance company for permission to do that. As I said, if we lived in another place in the country, that wouldn't be a problem on Medicare Advantage plans, but it is here in Virginia. And so that's why in Virginia we have a lot lower percentage of Medicare beneficiaries on Medicare Advantage plans than the national average. So sort of summarizing that, on original Medicare, your premiums will be more expensive because you're going to have to pay for that Medigap policy. 65-year-old, probably $100, just going to say $100 for a Part G plan. However, you are more certain of your coverage because it's that Saturday night and you're worried about calling that ambulance with all that possibly is going to go on. That's a medical question. That is not a financial question because worse, it's going to be $257 for the year. On a Medicare Advantage plan, the premiums are much less, and you have the possibility of extras that may or may not be able to be used here, but you are less certain about your coverage of whether or not the insurance company is going to pay for that. I was talking with someone this morning who last night broke their foot, and the insurance company said, well, I know the doctor says he wants a CT scan of this to see if we want to do surgery, but you're going to have to wait 16 days before we will approve to have that CT scan. And the doctor wants a CT scan today. So that beneficiary had to waive their right and say that they would pay for it if the insurance company didn't decide they were going to pay for it to get the CT scan done today, versus waiting 16 days with a broken foot to get approval to have the CT scan. If you're on original Medicare, they have ran the CT scan by now. You're done. So, vastly different in how they operate. So, as I said before, I'm going to leave that away. As I said before, if we're on original Medicare, A and B, great. In a Medigap policy, the state offers a package called Advantage 65. And of that package, it's got 4 things in it. First, it has the supplement, the Medicare supplement. It's very similar to a Medicare G plan in the open market. So you have the supplement, you will have vision, you will have dental, and it offers prescription. Now the vision and the dental is pretty good. I always have to tell people, you need to set your expectations when you leave work and your expectation with your dental or vision insurance. Because when you are at work, you paid this much for your dental insurance because it was subsidized by the company. So you didn't pay much and you got this much benefit. Now you're leaving work and now it's subsidized. If you're out on your own, it would be subsidized none. And so now the differential is just a little bit of, you get a little better benefit than what you're paying in for the insurance. Now the Advantage 65, the dental and the vision is about halfway in between that. So it's pretty good dental and vision for what, it's really good for what you can get once you've retired. The prescription part of the Advantage 65, and no one seems to know why, it is very comparable with any Medicare Part D plan, except it's wildly overpriced. It's about $118 a month for the premium to have the plan, and there are 4 plans starting in January in Medicare Part D that are $0 premium, and those plans are very similar, if not identical, to each other. So you would be, no one can explain why it's that. So most people, if they take Advantage 65, they'll ditch the prescription part of it throw it out and replace it with a Medicare Part D plan. And they come and our counselors help them do that. So Advantage 65, it is, the supplement part of it is a little pricey, but the stability of the price, it doesn't go up much. And on a plan G or so, you may start lower, and every year it goes up a little bit by your age, not your health, but by your age. But so at some point you reach the point where you've hit where the Advantage 65 is. So we don't know yet what the 2026 Advantage 65 prices are going to be, but I see some people go with the Advantage 65 because they want the security of it, or the perceived security of it. And then, but I see a lot of people go, well, the whole package is more expensive than what if I went and got this stuff out on my own. You know, went and got a regular Part G from any insurance company at $100 a month. Because the supplement this year, just the supplement part of it is $177. And that's great if you're retiring at 75. But if you're retiring at 65 and you can get a supplement policy at $100 a month versus $177 a month, that's a big difference. That's a lot of money. So, but it's a player's choice. And we can help you crunch the numbers on an individual basis. I get out and I do new to Medicare talks. I do talks in the community all the time, much like this one. And I tell people this is the starting point. Really what you want to do, the next thing is make an appointment and sit down with one of the counselors and one-on-one and really crunch your situation, because the right answer for one person is not the right answer for the next person. Now, we were talking about Part D prescription drug coverage. As we said, for finding one for somebody, all we do is go to the Medicare.gov website. We enter your prescriptions in, what pharmacies you use, and then it will list the plans in order of here's the best one for you to the worst one for you. So it makes it really simple to figure out which one works for you. That's how we start with things. Now, a couple other things about Part D. I started to jump ahead of myself there. They have put in a cap for how much it will cost you at the pharmacy picking up your prescriptions for the year. This year it's $2,000. In January it'll go to $2,100. For people who are on low-tier maintenance drug, this doesn't matter. They're never going to get to that amount. But people who are on some high-tier, some pretty significant drugs, this $2,100 cap is a godsend, because if it wasn't for that, they may be paying thousands and thousands of dollars more for their prescriptions at the pharmacy. So this is great that they put this cap in. It just started this year. Now I'm going to grab a drink of water. And as I said, we are starting to get into Medicare open enrollment. So every year, October 15th to December 7th, but it only has to do with part of your Medicare. It has to do with either the Part D if you're on the original Medicare, or your whole Medicare Advantage if you're on Medicare Advantage plan. Let me talk about like a Part D as an example. Why there's open enrollment. Every year on January 1, every company changes everything about every one of their plans. It changes what the premium is, what the deductible may be if it had a deductible, and very big, it changes what drugs are covered and which ones are not, so what's on the formulary, and how much each one of those prescriptions are at each pharmacy. So, so people say to me, I like my plan this year, I'm just going to keep it for next year. And I go, that's actually not an option. You would get next year's version of that plan, which could be vastly different than the one that you have this year. We help people look at their Part D plans or their Medicare Advantage plans to see if they want to change, or if it's a good idea to change to a different plan for next year. This last open enrollment, we saw 2,937 people in 7 weeks. 50% of them Their plan, next year's version of that plan, was perfectly fine for them. But 50% of them was, oh dear God, we need to change plans to a different plan. And so we changed them. So you have every year when you come into open enrollment, it's basically a coin toss of whether or not you need to change plans or not. And it's been that way every year for a long time. We can see the numbers now for 2026, and I actually predict more people will be changing plans than in any previous year, partly because, and again, this is very small for you to see, but plans that are in red are going away and no longer will exist in 2026. Green plan is one that's going to be coming in. I see some big things here. If somebody was on an Anthem Medicare prescription plan, just a prescription plan, Anthem is not going to have any plans for 2026. So if you had that plan and you did nothing and you didn't check to see what you might change to, January 1, you have no insurance for your prescriptions. That's bad. Cigna had 3 plans, the lowest one being a $17.80 premium, and they're doing away with all 3 of those plans and pushing everybody into a brand new plan that won't be $17.30, it'll be $133.80. So I'll see a lot of people this year getting off of Cigna and going to other plans. Then down below here, what ended up, we've had a plan in the area for several years that's 0 premium. This year now we're going to have 4 plans with 0 premium. So that's really good news. So there's going to be more options in a low premium plan. And in SilverScript, if you happen to be on that one, they went up last year from like $10 to $28, and now they're going to jump it to $78. So I see a lot of people who will walk in our doors for open enrollment are going to be moving off of SilverScript also. So you can see just by premiums, not even the drugs, people are going to make lots of changes in this open enrollment. It's really sort of important. As I said, last year we saw 2,937 people, and half those people changed plans. So we are able to calculate and say, well, if you didn't change plans, you would have been on this insurance, and you would have been paying this much in premiums and picking up your drugs at your pharmacy. However, we changed your plan, so now you're going to be paying this amount total for the year. Subtract one from the other, and we get the amount of money that we saved people last year. Yep, a little over $4 million we saved people on their prescriptions and their premiums last year. So it's important that once you're on Medicare, and you check in open enrollment, and again, I got 67, I think it is, volunteer counselors ready to help you this year. And so plenty of room for us to help you walk through this. And back to where we started with, they're volunteer counselors. They're not trying to sell you anything, and they're not trying to make any money. They're just there to help you. So, a couple other important things that are new this year too is in the state of Virginia, we have a new rule went into effect on January 1 called the Medigap birthday rule. And it allows you to shop for a better price on your Medigap policy. And you got a window of time of 60 days that starts with your birthday. So everybody's time to do this is different depending on their birthday. You do have to have a Medigap policy, a supplement policy to start with. You can shop, but the big thing about the shopping is you have a guaranteed issue rate, which means the insurance company has to take you. They have to give you their best price for your age, zip code, or male or female. And most importantly, they can't ask you anything about your medical history. So I could have somebody, like in this situation, who could run a marathon, and I got another person who has cancer and has had 3 heart attacks in the last year. Every company has to take them. And if they're the same age, the same zip code, and same gender, they're going to get exactly the same price from that insurance company. And once you're in, you're in. They can't get rid of you unless you forget to pay your premium. So you always set that up on auto pay. But then every year, as you age, it'll creep up a little bit, 3.5%, 4% on your age, not your health. I have one of my counselors who actually years ago had a bad spring where he had a couple of heart attacks, a couple of surgeries, 3 hospital stays, all in the spring. And again, because he had the Medigap policy, his total bill for the year was $257. That was his medical bill. He jokes with me and says, my insurance company's never making their money back off me. So it's like, so it's great to have the Medigap policy. Now we're allowed to, in the state of Virginia, to check every year and see if we can get a better price for our Medigap policy without any medical underwriting. So that's great. That's a new law in place. We're helping a lot of people walk through that process. Now, if you're on Medicare and you are higher income, you will pay more for your Medicare Part B and your Part D. So you're going to pay more than like for this year, it's $185 is the baseline for Part B. But if you're above $106,000 as an individual on your tax returns, or $212 for filing jointly, then you would pay higher. And then there's brackets here, and you can kind of see this on the screen. It's a little bit there. And then it always looks back 2 years of your tax return by default. So we get people who are retiring, and they were making pretty good money, really good money when they were working, and now they've retired, and now they're not making that kind of money. However, Social Security is looking back 2 years, looking at the tax return and saying, well, you owe IRMA on your Medicare. You can at any time submit a request through Social Security to have that reevaluated based on what you're making now. So if you're making a lot less money now that you've retired, and you might move down on the IRMA chart or completely off the IRMA chart, that's great. So there's for people who are filing individual, people who are filing jointly. There's an IRMA chart for people who are who live with their spouse but file separately. So there's a separate chart for that. And then there's the chart here where it will add to your premium for your Part D, your drug plan, also if you fit into these IRMA situation here with your income taxes. On the other side of it, you've got things like people for low income, you got Medicaid or Medicare savings programs, which do various things, or where we deal a lot with what's called Medicare Extra Help, called LIS, and that's for people, that helps people lower their cost of their prescriptions if they're low income, kind of capping out the amount any prescription can be, like a brand name can't be any more than $12.15 if you qualify for LIS Extra Help. So, you know, there's both sides of the scale there. There is a lot to Medicare, and there's a lot to that there are always caveats to caveats to caveats. People will call us and say, I'm turning 65, should I enroll in Medicare? And I go, well, that depends. Are you still working? Are you getting insurance under yours or your spouse's? If you are, is that company they work for have under 20 employees or over 20 employees? All of that changes it. Is the insurance you have now have a health savings account? That changes the answer that I would give somebody is, should I enroll in Medicare? So, and everything along the way with Medicare, it's that kind of things. There's several questions to ask to determine what the right answer is. We have had people go to other offices and get like, just, oh, you're turning 65, here's the flat answer without asking any questions. And I'm like, I guarantee you that was the wrong answer. So, because they didn't ask all the questions that, this is why, like my counselors, I talk about them being highly trained. Just the counselors that all they do is Part D prescription insurance go through 15 hours of training. just to be able to understand that. So that doesn't count the full counselors who do new to Medicare and everything. They go through a lot more. So I advise anybody, and I know that UVA HR is very good about telling people as they retire here, now you need to go talk to JABA about your Medicare, and we love that they do, and they love that we're there to answer all those questions, because it is complicated. And I would hope that anybody who is either turning 65, want to know what they want to do about Medicare, or retiring and want to know, okay, now what do I do? And we always say, you want to come talk to us about 3 months in advance of those things, so that we can then set up a timeline and say, this is what you need to do and when you need to do it. Because some things take a while. So 3 months ahead of time. On the JABA website, and also back on the back table here, I have intake forms that, you fill out an intake form, it comes up in our computer system, and then one of my admins calls you and schedules an appointment appropriate for what your needs are. So I think I've covered that. I do know, and you had walked in late, but why I started and was talking to nobody at first was because there's a whole bunch of people online watching this. And so if you are online, you feel free to call the JABA office and ask us any questions or so. And obviously I'll be here to answer any of your questions afterwards or so once we close up too. But it's just, I do this because I think it's important. I have turned down much higher paying jobs to work at a nonprofit so that I go to work and help people every day. And that's why we also have all these volunteers in our program that volunteer their time and their efforts to serve the community, because they know it's important. And they help people every day. So I appreciate UVA giving me the opportunity to speak today, and I'm just hope you all have a good rest of your day. Thank you.